Welcome, everyone. I'm Lisa Esquivel-Long, editor of KPC Media and Fort Wayne Newspaper's Greater Fort Wayne Business Weekly, and I'll be your moderator for today's webinar. This is the latest in a series that we're bringing free to subscribers. The topic of today's webinar is called An Alternative Solution for Employee Health Insurance, and it's brought to you by PMG Agency. Due to overwhelming response from last year, PMG is back to talk about its Premier One program. We want to hear what you're concerned about. So during today's webinar, please ask your questions by going to the Q&A section that you'll see in the right-hand side of your screen. We'll go over your questions after the presentation. So with us today are PMG owner, Scott Pearson, office manager and head of Premier One program, Karen Shear, and her assistant, Morgan Tryon. So welcome, everyone. And please tell us a little bit more about your agency and what you'll be discussing today, Scott.
Well, thank you. First, I'd like to say good morning to everybody, and thank you for participating in the webinar today. We're hoping that we'll be able to provide you some very interesting and exciting information today. PMG Agency was established in 1999, so we are doing this and going on our 25th year. Karen, my assistant here, who is in charge and who is oversees the Premier One program, has been with me in the agency for 15 years now. So quite a bit of experience. We specialize in employee benefits, Medicare, and individual health insurance plans. So I'd like to go through a program that we developed in, was it 2018, Karen?
That's right. Yeah.
Yeah, 2018. So time sure flies by and a lot of growth in that, but we'd like to go through this program with you. And like I said, hopefully we can provide you some exciting information today. So Premier One, like Lisa said, it's an alternate solution that we came up with for employee health insurance benefits. So go into, sorry, there we go. One back. There we go. So what is Premier One? So Premier One was a third-party administrator that we started that assists employees to pay for individual health insurance premiums through payroll deduction. I think I'm going through, clicking too fast there. There we go. Oh, one more. There we go. So what businesses are a good fit for Premier One? Really, any industry. We have a multitude of different industries, from attorney groups to doctors' offices to factories to just about any industry you could think about. Also, any businesses that have W-2 employees, 1099 employees, or both. So we do have Premier One programs that do have 1099 employees that are participating along with the full-time employees. And businesses that might want to offer options to both full-time and to part-time folks. With the job market today and some of the feedback that we get, that we do have some companies that are offering benefits now to employees that are working 20, 25 hours. So it gives you a lot more flexibility. And with the average employee income of $18,000 a year or more, anything less than $18,000 would probably qualify for Medicaid. And we really specialize with businesses that have 50 or fewer full-time employees. That 50 plus is where the cutoff is, where it's mandated to offer health insurance benefits. So we have a lot of companies that are up to the 50. We still can do Premier One program for companies that do have more than 50 employees, and we do have those companies with us, but just a little bit different guidelines that we have to follow from that aspect. So let's talk about why employers are choosing Premier One. The biggest reason is the cost and the flexibility. A lot of questions that we have or comes in, or statements that we'll have, is just as you can see, is I just received a huge rate increase in my group health insurance plan, and I just can't afford it anymore. And I think a lot of you have heard that common theme. We can't meet participation, for a group health insurance plan. We have 17, 18 employees, but we only have 3 or 4 that want to participate in the plan. Or our company's just too small to offer health insurance. We only have 2 or 3 employees. And another one that's coming up quite a bit now is we have employees that are in multiple states. So that also gives that a lot more of that flexibility. There we go. There we go. And why employees like the Premier One program? First of all, they get to choose their own health insurance plan that fits their needs. On a typical group health insurance plan, the employer might offer one, possibly even two plans, but the employees have to take that plan if they'd like the insurance. With the Premier One program, I believe, how many are 46, Karen?
Yes, at least options.
Yeah, just in the Allen County area that they can choose from. So they get to tailor make and pick a plan that's designed just for them, that fits their needs. And they may qualify for the subsidized tax credits and cost sharing. There's no pre-existing conditions or waiting periods for anybody that signs up. And for companies that have 20 or more, there's no more COBRA paperwork. The monthly premiums for the individual plans are paid directly through Premier One. So there's no waiting for reimbursements from an employer if they should offer them money to buy their own plans. So let's take a look at the Premier One individual plans versus a typical group health insurance plan. Well, with Premier One, as we mentioned, there are no minimum contribution limits. The business determines its own contribution strategies. There's no participation limits. So again, we talked about a company that might have 16, 17, 18 employees, but only 3 or 4 need or want the insurance. We can accommodate that. And I think the biggest thing is, especially for folks in the HR portion of it, there is no paperwork. It's less than 5 minutes a month. So we take away the administration hassles that you would typically have with a group health insurance plan with renewals, et cetera. And with group health insurance plans on the other side, yes, the employer must contribute 50% of the employee-only premium, and that's a minimum. They still have to meet 50% participation in a lot of cases. So again, you talk about a company that, might have that 18, 20 employees. Well, now they'd have to have 10, maybe 11 that have to take the plan, and it requires a lot more additional paperwork. As far as like the annual renewals and the shopping of the plans each year. So that just makes it a lot more easy. So what we like to talk about too is what we see as an increase in employee participation and also the retention when we bring in the Premier One program. So this is one of the groups that we have, and you'll see they have a current group health insurance plan that had a $5,500 deductible. They had 8 of 20 electing coverage due to the high cost. At the time, the employer told us they had about 37% turnover. So as you can see on the bottom chart, they had 3 employees that were taking the health insurance. The individual premium was $600. The employer contributed 80% of the employee-only premium, which left the employee's portion at $120 a month, or their weekly payroll deduction would have been $30. So you can see it kind of goes down with employee and child, employee spouse, and the full family. So you can see on the family plan, the premium $1,590, the employer did not pay or contribute anything towards the dependents premiums. So once again, you're looking at $278 just in weekly payroll deduction for a family. Once we put in the Premier One program, we still maintain the same $5,500 deductible on the silver plan they had before, but now we had 7 of the individual employees instead of 3 sign up. The average monthly premium after the tax credits was $270 a month. The employer still contributed up to that $480 that he was paying before on the group plan. So now the employee's portion is 0. So now the employee went from paying $30 a week to 0 for the month. And on top of that, with the Premier One program, the employer was paying $480 on the group plan, and now the employer is paying up to the $480. So now that same individual premiums for these single employees is only $270 a month that the employer's paying. So you can see it's a big difference between the 2 programs and the difference in the premiums. And if you look at even the bottom on the family, it went from $278 a week for payroll deduction to $107. So in some cases, when we put Premier One in this, employees can actually end up getting a substantial raise on their paycheck compared to what they were doing before. So let's take a look at the national averages of people that are enrolling into individual marketplace plans across the 37 marketplace states. In 2022, 14.5 million people enrolled into an individual health insurance plan on the marketplace. The number of people receiving tax credits, as you can see, was 12.9 million people, or 89% of the people that enrolled in the marketplace received a subsidized tax credit. And the number receiving the cost sharing, which I'll go through in a couple more slides, was 49%. Now we look at a year later in the 2023 enrollments, 16.4 million people enrolled. So you can see the trend is going more towards these individual plans and more towards the subsidies and the cost sharing that's available to folks. So let's talk about what is an advanced premium tax credit. It's a tax credit that the government provides for you that you can take immediately to help lower your health insurance costs. It's based on your income. So that's how you see a tax credit is determined. It's estimated by the household taxable income. Now, what would happen if you estimated your income too low? Well, potentially at the end of the year, you could owe some of the tax credits back. But also on the other side of the coin, if your income was estimated as too high, then you would get that tax credit back on your tax return at the end of the year. So we also mentioned cost sharing. So in some cases, folks will also receive cost sharing. I believe, Karen, we have families that are getting out of pockets and deductibles that are under $1,500 a year, total out of pocket expenses.
Yes, even deductibles as low as 500.
Right, right. So the government says that for this year that nobody should pay more than 9.56% of their income for health insurance. But based on where you fall within your income bracket, like I said, you could qualify for cost sharing as well. That does also include prescriptions, office visits, etc. So each plan does have an out-of-pocket maximum. An out-of-pocket maximum is the maximum amount you will spend per year for your health insurance. That includes your medical expenses, your prescriptions, copays, and your deductibles. So everything funnels into one bucket. In 2023, that amount is $9,100 per individual. So no matter what would happen in your life, and if you had something tragic happen or something and you had end up with a $200,000 worth of medical bills, you would never pay more than that $9,100 out of your own pocket for the whole entire year. As you'll see in 2024, it's $9,450. For families, it was $18,200. Whether you have 2 kids or you have 5 kids, the same family applies. And for 2024 is $18,900. So how is the premium tax credits and subsidy determined? Well, here's a chart that shows you. You'll see on the left, it says the number in the household, and then it shows the income levels and where you would fall. And it can give you an idea. But I think what's really interesting is that during the pandemic, during the COVID era, the government extended the tax credits to help folks out with their healthcare costs and their premiums. Those additional subsidies and cost sharing has been extended through 2025. So not only with the year coming up, but the year after that as well. So I think, Karen, you'll see at folks that are at 400% of the federal poverty level before would not qualify for tax credits. Now there's no limits. So we do have folks that we'll show in the next slide for some of the quotes we have that are in 6-figure incomes with 1 child that are still receiving tax credits. So here's an example of quotes. Karen, you want to go through the quotes here with them?
Sure. We've got a family of 4 here on top, living here in Allen County. Their total household income is showing estimated at $90,000. So that put them at the federal poverty level of 324.32%. They had estimated a tax credit then is showing $1,253. So that tax credit is going to reduce the premium of whatever plan they choose. For example, you can look at a bronze plan, it's showing about $229 a month now for them. A silver would be about $462. And then you also have the gold would run about $818 a month. And with the Premier One program, we work with the individual employees. We've got a whole staff of agents that we are trained. We work with, the employees as far as, determining what plan best fits them. Then we also have the family of 1 right below that. This is a male, 61. Looks like he estimated his income at 43,000. Based off of that, his tax credit is showing $725 a month. It reduces his premium by that amount. So gosh, you can see a bronze plan is running about $47 a month if he chose that plan. Silver, you're looking at about $227, and then of course the gold $589. And then we go on, we've got a family of 3. Typical husband, wife, they have 1 child, age 6. They're making an income of $125,000. They are still receiving a tax credit of $782 a month. Bronze plan is going to run them maybe about $532 a month. Again, they could choose a silver for $889 and go up to a gold at $1,315 a month. Then the very last one here, we got a family of 1, female, age 42. She is estimating her income this year to be at $39,000. She is still going to receive a tax credit of that $289. Again, bronze plan would run her about $114 a month, silver plan $177, gold $274. Amazing.
Yeah, so you can see there's quite a bit of savings compared to if they were on a traditional employer group plan with these savings. And just to kind of go through, the bronze plans are more of the what we would consider the high deductible, more of a catastrophic plan. Some of those plans still include co-pays and prescription cards, but they're more, like I said, of the higher deductible. The silver plans are kind of the middle of the road, if you would, more of like a 70-30 type of plan, still including your doctor visit, co-pays and prescriptions on most of the plans. And then the gold would be the higher end plans, the lower deductible. On some of the gold plans, they go down to actually a 0 deductible and just goes right into co-insurance. So you can see, based on the tax credit, it's still affordable for a lot of people, even on a gold plan. So let's talk about what is a defined contribution that we refer to multiple times. It's a fixed dollar amount that each employee can use to purchase an individual health insurance plan through our agency in the marketplace. And that amount is set by the employer of what they want to do. It allows employees the opportunity to, allows employers to offer different contributions based on job class and or job description, which I will show in the next slide here. It also allows employees to be more involved in their health insurance choices. Since they're picking their own plans that's tailor-made and fits best for them, there's a lot more satisfaction with their health insurance, and they're a lot more involved in their health insurance decisions on a daily basis. And if the employee chooses a plan that costs more than what the employer's contribution would be, the employee pays the difference through simple payroll deduction. So we have different classes and different employer levels that we offer. And this is something a lot different and a lot more flexible for employers and HRs. As you can see, on a typical group health insurance plan, you would pay a percentage, which would be maybe that 50 to maybe, as we gave an example, paying 80% of the premium on the previous slide. That has to be the same for basically everybody across the board. With the Premier One program, it offers a lot more flexibility. And Morgan, you do a lot of these setting them up. You want to talk about how this works for the classes?
Sure. So as an employer, you have the option to offer to contribute different amounts. So, you could offer an employee only, this amount. Employee spouse could get a little bit more versus, an employee child or a family to kind of help offset the difference in what the premiums would be. And at the bottom, you can see, regardless of, what type of company you have, you can break it down by class. You can offer, for this example, production workers get this much, supervisors get this much, administration can get a little different, as well as part-time. So you have a lot of flexibility to offer different amounts that would work best for your company.
Right. I think one thing to mention too is the defined contribution amount needs to be a dollar amount and not a percentage. If you're offering a percentage like you did on a group health insurance plan, kind of negates some of the savings that could be out there. So if I'm an employer and I say I'll pay 80%, if I'm an employee, I'll be buying the gold plan every time. And also, based on age and different plan designs, if you're offering by percentage, it could constitute some discrimination with choosing plans. So I do want to talk about an individual coverage HRA, or referred to as an ICHRA. It's kind of a buzzword. It's been in industry now for the last 3 or 4 years that a lot more people are hearing about. And ICHRA is the same as basically what we're offering with Premier One. However, the employer contributions would be tax-free to the employee. But however, if they do decide to go that direction, then it would negate, or none of the employees would receive the subsidized tax credits or cost sharing. So in most cases, the ICHRA would be a secondary option and the Premier One would be the direction to go. So, if you say with an ICHRA, generally when we see employees that average more than $70,000 a year, might be a good fit because they're not going to qualify for the tax credits up front anyway. So I did want to talk a little bit about that because we do have people that'll call and say, I heard about this individual HRA. What is it? So with optional ancillary benefits as well with Premier One, if you currently have a group plan and you're going to move or would like to look at moving to the Premier One, you can still keep your dental, your vision, your life insurance plans on a group chassis like you currently have. That does not change. We also are excited just to mention as well that we have our own exclusive product just developed nationally for Premier One that is an accident plan, a hospital indemnity plan, and a critical illness plan that's all bundled together, and it runs less than $50 a month per employee. And those benefits are also tax deferred and can be put together on a group health insurance plan, and we only need 3 to enroll. So it's a very, very good program. And like I said, we just got it last month.
Yes, super excited about
so
this.
we're getting ready for the big rollout on that. So one thing I did want to go mention is here's the invoices that Karen and Morgan develop and send out each month. And for us, we're a little bit difficult to see, but as you can see, it has, and this is an actual company, it shows the 2 different carriers, AM Better and CareSource. So employees did choose different plans with different companies within the program, and it shows their effective date, and then it shows the total premium. But if you look at the total premium at that, I believe $6,600 a month, but they're receiving, I believe it's $3,400 a month in a tax credit. Or $3,400 for the total. So as you'll see, 7 out of the 9 employees are getting insurance for less than $100 a month. And in some cases, we have a couple of them, they're not even paying anything for their health insurance now. And once again, just to reiterate, they're choosing the plan that they want that's the best fit for them. That is something that's very key. So the satisfaction of your insurance that you're offering through your company is very well received. And then you'll see it gives a total amount after the tax credits, and then the administration fees, and then the total due. The top part of the invoice is a summary of the total for everybody, and then the bottom is the individual employees that's on there. So this invoice is sent out each month. Karen, you want to talk about how the billing works?
Sure. So we send out the invoice the first of every month for you to review, make sure, maybe an employer left or you need to add a new employee to the invoice so that we can reconcile that. And then what we do is we schedule the ACH to draft on the 15th of each month. And then we begin making those payments actually on the 15th of that month for the following month's premium. So this past week, Friday was the 15th, we were making payments for October. So we are making them a month ahead of time. But this invoice, like Scott mentioned at the beginning, the administration is just so limited. I mean,
Right.
you have no 5 minutes, you look at the invoice and, we take it from there. We make the premium payments and schedule the ACH for you. That's
Right.
about it. Yeah.
Yeah, thank you, Karen. So I wanted to recap just real quick here. So once again, we think it's a great solution for small businesses to control the high cost of health insurance and health premiums right now. We do free analyzations. So if you'd like to give us a call and schedule a time, we'd take the opportunity to run our Premier One program and compare it against your current group health insurance plans and see, where there might be savings or see how it would work for your individual company. Again, it gives employers a lot more flexibility to do things. Even as we mentioned earlier on, for part-time, even 1099 employees can participate in this plan. And again, as Karen mentioned, employers are spending less than 15, really minutes a month on this. It's just reviewing your invoice, making sure everybody's, still on there. And that's really it. As we mentioned before, it can also increase employer participation when now employees are able to purchase health insurance for a lot less money, and in some cases, 0 monthly premiums. You're going to have a lot more participation, which we mentioned before can also cut down on your turnover. And individual marketplace plans with tax credits or cost sharing are available in multiple states. And employees can keep their plan even if they resign or terminated. So even with no COBRA, if you have an employee that's on the Premier One program, they leave for whatever reason, they contact us and we work with them to keep that current plan. And in some cases, we'll go back and adjust their cost sharing or their tax credits to allow them to keep that plan. And I think a big one too is with Premier One, we also offer assistance with transition to Medicare. We have a lot of employees that are still at the Medicare age of 65, but are still working as a lot of people are these days. And so we have an easy transition into the Medicare for the employees as well through our agency. One thing I did want to mention, I think I missed a slide in the very beginning when I was getting a little thick-fingered with the mouse, but I'd like to go back if you don't mind and see if I can get to that. There we go.
Yes.
And as Lisa mentioned earlier on, we did the webinar here last year and we had a tremendous response from that. And we had a lot of people asking about, are we going to do it again and how has it changed? But through our expansions and that Premier One, we've been able to develop some great partnerships with Chamber of Plans. As a partnership program of the Greater Fort here, we're able to offer 40% discounts off our administration fees. And we've also partnered with several non-for-profit organizations, which we're offering a 25% discount off administration fees for non-for-profit. Now, one of the questions comes up when a non-for-profit will call us, if I'm a member of the Greater Fort, do I get the 25 or the 40? Of course, you'd get the 40%, right? And with the continued growth of Premier One, we are now in multiple states, which is great because it's allowing us to work with companies that have out-of-state employees or satellite offices. In some cases, you have a group health insurance plan, you have multiple employees in multiple states. It can produce some issues with networks and coverage, et cetera. So I did want to mention about our partnership programs and the discounts that are available for that. So I think I can go forward here now. I do apologize about missing that slide, but I thought I'd need to go through that again. Excuse me. So let's go through a quick Q&A that we have from our previous webinars and some employer meetings and things that we do that come up. Can employer contribution be pre-taxed? Again, that would be only, as we mentioned on an earlier slide, if they did an individual coverage HRA. So if that was the case, then again, the employees would lose a tax credit. So any monies that employer would give the employee, that monthly defined contribution, would have to be counted as income. So for instance, if the employer is going to give the employees $300 a month at the end of the year, that $3,600 would have to be put on their W-2s. That is not insurance companies' guidelines or our guidelines. That is the federal government's guidelines and the IRS. So we have to follow those. What happens when an employee terminates? Again, we mentioned that the employer or the employee can contact us, and then we're going to reach out to an employee. We do a 3-method contact. We send out an email, we send out a letter to that employee, and then we actually make a personal phone call to help them keep that insurance. In some cases, it could be something that's unforeseen, like an illness of a family member, and somebody might have to take off work for a couple of months or something like that. We're here to help them adjust that tax credit, potentially even help them lower those premiums during that time, when they're going through that, that ordeal. So that's what would happen if somebody would terminate. What happens when an employee turns 65? Again, we have a staff through our agency that would help them easily transition into Medicare. They sit down, they do a one-on-one, they answer all their questions, and they help them find the right plan for them. One thing that I'd like to iterate about that with PMG as well is that we are a general agency, which means we are contracted with all the insurance companies. So we have the option to go out and look at multiple companies. So we take an unbiased approach. We're looking at an approach is what is best for your employees and what is best for their individual needs, not what's best for the insurance companies. And as we mentioned, Karen mentioned, the invoices, they're electronically sent out on the first of the month. And then we go out and pull the funds ACH on the 15th. And then what are PMG administration fees? That's always a big one. So discounts are available, as we mentioned, through the Greater Fort at 40% discount, or for non-for-profits that are at 25% discount. But with group sizes with 1 to 5 enrolled, that is $35 per enrolled employee. And if you have 6 or more enrolled, that administration fee is only $20 per employee. So that's, I think, the presentation. And we're here to answer any questions or go through anything that we might not have covered.
Great, Scott. We do have a question from, I think it's Kimmy. She wants to know, does this program have a specified open enrollment period? What is the best time for an organization to look at switching?
Yeah, that is a fantastic question. I'm glad that was brought up. Open enrollment every year is November 1st. And it goes through December 15th for a January 1st effective date. And it's also available from December 16th through January 15th for a February 1st effective date. Now, the question comes up is, can I enroll in Premier One anytime? If you are on a current group health insurance plan and you would like to move to Premier One, it would qualify as a special enrollment period. So employees that were enrolled in a plan, we could move outside of the open enrollment period.
Great. Okay, we have another question from someone in HR. They would like to know, how long does it take for you to do the evaluation for an organization and get it set up?
Morgan, what would you say? How long's the evaluation?
So we would have the employer send we would send the employer forms with just basic information, date of birth, zip code, estimated household income for each employee. And then once we have all of those, it takes maybe less than an hour to get that out to them.
Yeah, in most cases, we're doing turnarounds the same day. Now, of course, I will say that we're getting a lot of requests, and sometimes we'll have 3 or 4 that might come in a week. But yes, we can generally turn that around in a day for you.
Great. And I don't know, does anybody else? I'm not seeing any other questions at the moment. So I just want to just thank everyone. And I hope that this was very informative for people. And I hope everyone watching has a better understanding. Oh, maybe something else just came in.
Yeah.
Does the employee file claims?
No, employees do not file claims at all. This is treated the same way as a group health insurance plan would be. So they would have the same thing. It's just instead of like working with PHP or a United Healthcare, they would have their own individual plan with AM Better and CareSource, like for instance, here in Allen County. And with both those carriers, I would mention all the hospital systems are covered. It's a very extensive network that's available compared to even 2 or 3 years ago. More doctors are signing up and contracting with the individual companies. And actually, as we mentioned before, with the more people that are signing up for individual health insurance plans, not only here in Indiana, but throughout the country, there's been an expansion of insurance carriers. So for instance, in the Marion County area down in Indianapolis, this year for open enrollment, there'll be 5 different insurance companies to choose from. So it is by county and region. We have some states, for instance, we have a Premier One program in Texas, and in one county, they have 11 insurance companies to choose from. So once again, we do the evaluations. We're there with an unbiased approach to help those employees enroll what's going to be the best network. One thing to talk about as well, Lisa, as Morgan and Karen and the staff, when they're working with your employees, they do a very great job of their due diligence of looking up the networks, making sure your doctor is in network, they're accepting new patients, et cetera. So it's not only just enrollment, but there's a lot more they do as well to help your employees too.
And Jamie was curious. She wanted to know if this was Allen County only. I'm assuming for the coverage, not the discount, but is it only for Allen County? She works in her company's Whitley County. Obviously, it's throughout the state that.
Yeah, and actually, not only the state of Indiana, we have Premier One programs now, and I believe in 9 states, Karen. Yeah, so we've expanded. We're actually doing programs in 9 states right now. Just here locally, we have Indiana, Ohio, Illinois, Kentucky. We have Tennessee. We have a company in Texas, Florida, the Carolinas, Georgia. So we've expanded out, and a lot of it just came on for referral. So we can work with just about anybody, anywhere.
Not a problem.
Okay. And somebody wants to know, I don't know if you know this offhand, they want to know how many companies are available in LaGrange County. I'm assuming they mean health companies or.
The insurance carriers probably. I believe in LaGrange, it might be, I think it's 3 this upcoming year.
Yes, 3.
Okay, very good. And our employer, let's see, employer contributions deductible.
Yes, they are. We actually would suggest that employer refer to their accountant just to go through it. But yes, it would be considered as a business expense and deductible, just the same as it would on a group health insurance plan.
And is there a reimbursement for out-of-state provider or out-of-network providers?
No, there is not. If it's an emergency, no matter where you're at, it will be considered as in-network benefits. But if it's just a routine or it's elective, then you would need to stay in your network the same as you would whether you're with PHP or Blue Cross or even United Healthcare.
Okay. And I think that kind of answers another question, which was what is the difference between in-network and out-of-network charges? So.
Right. And as mentioned, and this is part of the healthcare reform law, that if you do have an emergency, it will be treated the same as that is an in-network claim.
I guess Jamie did want to know what the discount would be for Whitley County, if there is any.
If you're a member of the Greater Fort, you would get that 40% discount, or if you're not for profit, a 25% discount. We actually, Morgan sends quite a few referrals to the Greater Fort with our partnership program with them for folks that are not maybe currently a member of the Greater Fort to receive these great discounts.
Yeah. So. And you mentioned 37 marketplace states. Can you explain the difference in these states that don't, in those states that don't offer marketplace insurance?
Yes, absolutely. So some states, and I think this kind of reiterates what we were talking about with the growth and expansion into the individual markets nationally. Some states are actually starting and developing their own private exchange, so they would not be a part of the healthcare.gov marketplace. Kentucky was 2 years ago. Virginia this year just started their own exchange. So some states will have their own individual marketplace exchange and do not go through the healthcare.gov platform.
Okay, and Kelly wanted to know, did you say a minimum of 3 employees? I wonder if the question is maybe, can you be like a freelancer, a single, one person company and get this insurance? I'm curious if that.
Yes, absolutely. Yeah, when I refer to the 3, that was on our new product, the accident, critical illness, and hospital indemnity bundle plan that we have to have a minimum of 3 enrolled because it is on a group chassis. But for Premier One, we have multiple companies that have maybe 1, 2, or even 3 employees.
Okay. And this person saw that Better and Care Source. Obviously, those aren't the only policies you offer.
Depends on the county.
Yeah, depends on
where they live, what
right.
carrier might be available.
Right. In some counties, for instance, like in LaGrange, I believe Blue Cross Blue Shield has expanded into that county as well. So it just depends, and by county, what carriers are available.
Got Ascension maybe coming in, Cigna. There are some other carriers, just depends on the county.
Okay. All right. Well, I think that's all for the minute. We'll see if anybody else pops in. But if you didn't get your question answered today. PMG Agency has graciously offered to respond in a follow-up email to everyone who registered today. We'll send out the video to everyone who registered, so be on the lookout for that. Feel free to call PMG for any additional questions or to schedule an appointment. You know, they did talk about doing that free analysis for you. So if you would like to view previous Business Weekly webinars, submit a topic you'd like us to cover, find out how you can become one of the presenters, you can visit us at www.kpceventbuzz.com/webinars. That's www.kpceventbuzz.com/webinars. The webinars are free for Business Weekly subscribers. And I want to thank PMG Agency for the webinar today, and have a great day, everyone. Thank you.